I always tell the story that as small 2s and 3s of physicians, when we were looking at a contract that was given to us by a payer, we looked at the global obstetrical rate, we looked at the payment for hysterectomy, and that was about it. And suddenly, when we were able to utilize the expertise of our administrative partners, I remember the first contract we negotiated, they made 83 changes in the terms of the contract before we even got to numbers. The kind of administrative expertise that's available to us as a large group enables us to have a seat at the table and to negotiate on an equal basis. And as we have grown, we have been able to purchase the systems, have access to the technology that enables us to obtain the data that we need and the metrics that we need to negotiate with large payers and hospital systems and other components of the healthcare system. And in fact, we are oftentimes appreciated by the payers because we can save them administrative costs, because the data that we give to them is in such a digestible form. We, as physicians, even though we might have thought it was a great idea, and we were able to dive in with extreme enthusiasm in projects like our own captive insurance company and our own laboratory, we would have never been able to accomplish this without the administrative expertise and project management skills of Women's Health USA, and also access to capital. We said to ourselves, we've got the intellectual capacity to run an insurance company, but we need help in contacting the right people, in finding the right education, in finding the right partners. And we never would have been able to accomplish any of those things which we are most proud of without Women's Health USA. Now, as we move into further endeavors, our laboratory was completely facilitated by Women's Health USA in terms of project management and day-to-day logistics and operational challenges. And as we move into other ancillaries like mammography, like ambulatory surgery centers, and as we partner with people across the country in establishing best practices, Women's Health USA is indispensable, and they've been enabling us to accomplish those goals that we really could only dream about on our own. Women's Health is able to give analytics and data on a wide range of financial metrics. We have the data, and data is power, and data to be able to tell someone if a particular location is giving them what they need, if a particular staffing level is important for them. Also, our group purchasing power has been extraordinary, and we are able to not only provide supplies at a very economical rates, but we also do group contracting with various providers for, let's say, ultrasound archiving of images or genetic testing or what have you. And we have a central clinical function that evaluates all of these providers that are coming in to sell us things, and we can vet those companies, screen them, and make recommendations to our practices in a very efficient manner.